So today, really happy to be here. I'm calling in from St. Paul's in the West End, the traditional homeland of the Musqueam, Squamish, and Tsleil-Waututh. And today I'm going to I'll just start with my disclosures. I don't have any. I will not be discussing any pharmaceuticals, but I will be briefly discussing some unregulated products. So this is because I wanted to just touch on supplements, vitamins, and so forth, which are really unregulated and not real pharmaceuticals in the traditional Western sense. But I have no financial associations with any companies that sell those or promote those. So, and I'll only be discussing them briefly. So I wanted to review aging because you can't talk about anti-aging without really talking about what is aging. So I wanted to review what we know about aging. And then when we talk about anti-aging or staying young or whatever, I put that in quotes because that means a lot of different things to different people. So what is the difference between extending our life expectancy or our longevity versus healthy aging versus an idea I'd like to, I don't know if you've heard of this, but one that we like to discuss in geriatrics is compression of morbidity. And I'm going to talk about those are different things when you talk about healthy aging. I will just discuss a few very sort of trendy ideas in extending life expectancy or improving health, and what anti-aging sort of looks like from an industry point of view, because there's a lot of money going into these sort of ideas, and what evidence we have for what actually works in terms of healthy aging, which is something that I do every day. Whereas the other stuff is a bit more theoretical, and you'll see that the evidence for a lot of this is either lacking or can be contradictory. So just to speak about aging and as geriatric or people that work with seniors, sometimes in North America we feel a little frustrated because we do feel like there's this constant sort of elevation of youth culture, that being young is important and being old has lost or maybe never had the same sort of elevated status that it might in, especially in other parts of the world. And as we have less and less multi-generational families, there's less opportunities for our young people to live with and really experience what it's like to live with older adults. And are we sort of losing the benefits of getting older, especially wisdom, knowledge, and lived experience? And so this whole idea of, well, you got to stay young, you don't want to get old, it gets a little frustrating, and it's like, is there a hidden message there, or not so hidden message that getting old is a bad thing? And so you see that when in these kind of industries where anti-aging is what they're selling. So this is actually, I just pulled this off some clinic in downtown Vancouver, and an anti-aging clinic. And they say the practice of preventive medicine in conjunction with cosmetic health in Vancouver. And you see it right at the bottom, it says, age is a state of mind. Aging is a treatable condition. And that just kind of goes, whoa. So aging is basically felt to be bad. But when you look at a lot of these clinics, the what they're really looking at is cosmetic procedures. So injections, Botox, liposuction, laser therapy, that sort of thing. And when I went on to this specific clinic, for instance, the only thing that sort of is similar to what I do was they did have part of their clinic that dealt with urinary incontinence. That seemed to be the only clinical condition that I would have thought of as preventive medicine. And so a big chunk of anti-aging is actually cosmetic and about skin care and looking younger. So I'll just put that out of the way. You can have your own opinions on cosmetic surgery or cosmetic procedures, but that is a big chunk of the anti-aging industry that I'm not going to talk anymore about. What I will talk about is when you talk about trying to stay young, what do we really want? And this sort of idea, this was put out in a paper at about 20 years ago now, just comparing sort of different ways that we can actually improve our lives, especially towards the end of our lives. So right now, the top of the screen, you see what we say is present morbidity. So morbidity meaning illness, lack of function, disability, that sort of thing. And usually, when you get to about middle age, a little bit older than middle age, into your 50s, 60s, 70s, you start getting a little bit less functional, more diseases, more chronic conditions. And this tends to build over time until you die. And so that's sort of the usual for many people. Not true of everybody, but for many people. And life expectancy is somewhere between 75 and 85, depending on where you live and your circumstances. Now, a lot of people think of anti-aging as life extension. So what we'll do is you'll live an extra 4 or 5 or 8 years, but what does the morbidity look like? Do you still have disability? Do you still have lack of function? And in fact, does it grow to even more severe and you end up with a lot of disability and your last few years are very dependent rather than living independently? You could increase your lifespan and also, delay the onset of that morbidity. So this is what you see in this third graph where, yes, you do live longer, but your years of disability are about 20 years, just like before. Whereas if you just extend your life and then don't decrease the disability, you'll end up with more years of disability. And then this whole idea, which is really what we're trying to do in geriatrics, is to prevent the onset of morbidity. And we may not increase the life expectancy very much, but we do want to minimize this sort of area, this triangle, the amount of time that you're spending with disability. We want to minimize that. So every time you think about life extension, and we have increased our life expectancy so dramatically over the last 100 years, but how much of those last decades are spent with disability and morbidity, and how good is that quality of life? So I think that's one thing that we have to constantly think about whenever we try to put anything in place that could change either your life expectancy or your disability. So I'll shift now, and as I said at the beginning, what is aging? Okay, why do we age? And then eventually we die. And actually, it's not totally clear. There's a lot of different theories. And in the end, I think a lot of people feel that it's not just one thing that causes your body to age or your brain to age, but it's probably a number of different things. But we're not totally sure exactly what those things are. And so that's where you sort of start with, how do we affect aging when we don't actually know what causes aging? So there's 5 sort of big categories of theories that the people have proposed, and there's various evidence from many of these things. So some of this is genetic. Obviously, if your parents and all of your aunts and uncles live to over 100, then the likelihood that you will is increased as well. So part of longevity is probably genetic. And some of this seems to be part of the DNA strands. There's things called telomeres, which are these little caps of DNA, which sort of slowly get shorter. And some people have longer telomeres than others and seem to, their cells live a little longer. How many times can your cells reproduce before you actually, the cells die off? Also seems to be, a lot of that seems to be genetically programmed into you, okay? But that isn't everything, because you can have two identical twins that will live markedly different amounts of years, and that, so even though they have exactly the same DNA profile. So there's more to aging than just clearly than just genetics. Endocrine has had a lot of interest, particularly when we was talking about estrogen for a long time in the 70s and 80s. There was a big push to give women back some of the estrogen that they had lost because of menopause, and that has really not been as strongly supported in the last 10 to 15 years. So the push and some of the harms of artificially giving people back some of these hormones has been seen as well. And then insulin is a huge topic in terms of glucose and what does insulin and insulin resistance actually do to your body as well. So there's a whole sort of research field looking at hormones and how they affect how we age. The immune system is becoming more and more of an interest, and obviously in the last 2 years with COVID, everyone's been very interested in how the immune system works. The immune system is one of the most complex things. I only understand it slightly better now because of COVID, but it's still a very complex thing. All of the chemicals that are part of the immune system, like the interferons, et cetera, how do they actually interact? If you have too much immune system action, that can cause problems. For instance, you see that with COVID because the immune system sort of goes crazy. You see that with autoimmune diseases. And aging may be partly sort of because of the immune system over time being a little overactive in some places and underactive in others. So the immune system and immunosenescence is what people call it. The aging of the immune system is also very interesting to a lot of people. Wear and tear, that's gotten a lot of attention in the last really 30 or 40 years, particularly around free radicals. And you'll hear this a lot, or damage to the DNA from somatic factors. So what we mean by that is, for instance, if you're out in the sun a lot, over 10, 30, 50 years, you end up having older skin. And that partly is because the sunshine, the ultraviolet light actually damages some of the DNA and makes your cells less able to reproduce and damages the ability to, and then causes, of course, also cancers. Which is the other thing that happens with DNA, that when it goes out of whack. And then this sort of, what is frailty? Is it the diseases that you have? Where does cancer enter into this? And then all of the deficits that you accumulate over your last after middle age, how does that interact to really cause aging? And we see this in the hospital all the time, where you have these folks that are only, in their 60s, and yet they seem to they've got all these diseases, particularly diabetes. So it goes back to this insulin idea, and they seem old. They seem like what you would think was an 80-year-old. They look old. They don't function as a 60-year-old does. They seem to be just older. And that seems to be partly all of these diseases and chronic conditions that they've collected over time. So needless to say, it's very complex, and it's probably not one thing. It's probably a number of things why we age. And there's still a lot of research going on in all of these areas. So I'll switch now to three sort of really trendy topics that has caused a lot of people to change their lifestyles. And the first is caloric restriction. So this came out from about in the last 20 years, there was a lot of studies of, it started in rodents, in mice. And if you, from when they were born, you restricted their calories, either fasting or just decreased the number of calories that they had per day, it seemed to have, in certain rodents, a real benefit. They lived way longer than you would expect usually. And as you see from this slide, this is some of the reasons that they identified in some of these mice. They seem to have less oxidation, so it goes back to these free radicals. They didn't seem as frail. They lived longer. They were leaner. They weren't as fat. There was glucose, less glucose intolerance. So it goes back to the insulin idea. Again, there's oxidation in here. And so there was a lot of interest in, certainly in mice models. And then they tried it in some other lab animals as well. And this down on the left-hand side here is the C. elegans worm, little roundworm. And if you decrease the amount of nutrients that you gave them, so overall calories, they lived 40% longer. It's really impressive. So that's like taking a human being and from 70, all of a sudden everyone's living 100. It's just remarkable. But these are worms. All right. And even in mice, depending on what rodent you use, different strains, and whether you gave them fewer calories, some seem to live longer. But one thing that you saw was that there did seem to be definitely less cancer. It didn't explain everything just on the basis of the number of cancers they had, and they did seem to live longer. Maybe fasting this day or not, and every other day did seem to affect some of these as well. Again, though, there was a linkage with cancer. So the effect on developing cancer seemed a little stronger than the actual extension of life. However, what about humans? Humans are not mice. If you're talking about restricting calories only starting in your adult years, you've got all these 30 years when you're a child, adolescent, young adult, where you haven't done anything about your caloric intake, whereas these mice were often, restricted in their calories right from the beginning. So what about humans? What did they find? Well, it's very difficult to do a caloric restriction study in humans. And there were some short studies that showed some health benefits, but it wasn't able to really see if people died less. That would just take too long. And a lot of these studies are only like 1 year, 2 years. People did seem to, have less diabetes. They were thinner. They had less of these negative outcomes. But even in people that were trying to decrease the caloric intake as much as they could, the average was really only decreasing it by about 10 to 15%. So not anywhere close to some of these animal studies where they were decreasing the caloric intake to like 40%. So it's very difficult for humans, especially if you've got an environment where there's a lot of food around, like North America. And if you're already overweight or overeating more than the caloric recommendations, a lot of these studies only brought people back to the recommended intake and not really any lower than what healthy or sort of lean vegetarians already eat. So there is no human studies that really show that this actually definitely improves health, but certainly increasing life expectancy. There's no good evidence of that at all. There's some certain groups of people, for instance, vegans in certain places seem to live a little bit longer. But it's hard to tell whether that's just because of their caloric restriction, because they often exercise more, they usually don't smoke, they have very moderate alcohol intake in a lot of these sort of lifestyles. So it's all kind of tied together. So whether just restricting your calories overall is beneficial is unclear. The other thing we know in geriatrics is that once you get to a certain age, especially if you're in your 70s and older, restricting calories can be actually detrimental. well. People end up with low protein intake, and that can affect their strength, their balance, and their risk of falls. So certainly something that I would say in a younger adult probably isn't that harmful necessarily, but in an older adult, you have to be really, really careful about. So, and really the evidence isn't really there for caloric restriction. We'll talk a little bit more about diet going forward. The second thing, which which is extremely popular on the West Coast, particularly, is supplements. So I'm talking about antioxidants, other herbal supplements, and then vitamins, both multivitamins and single types of vitamins. And this is a huge industry. $35 billion is spent every year in North America on supplements, vitamins, et cetera. And the evidence is not very strong. It's really not as strong as I think people might think it is. Linus Pauling came out in I think it was the late 60s, early 70s, talking about, mega dosing of vitamin C, that it would increase your immune system and, have other health benefits. Vitamin E was also touted for a long time in terms of being able to prevent dementia and heart disease. But the evidence on particularly those two vitamins has been very poor. And there were some studies that showed that vitamin E actually might cause strokes and heart attacks over time. So neither of those vitamins have been strongly supported in terms of if you're already getting that in your regular diet up to the recommended amounts, then mega dosing with these didn't seem to really give any significant benefit. And it's the same thing with multivitamins. It's helpful for people who have malnutrition, but if you're not malnourished, the benefit of a multivitamin is not there in terms of the evidence. It really doesn't show any improvement in health or longevity. Vitamin D, however, we know that people particularly in Canada and northern countries are often vitamin D deficient. And so that's probably why supplementing with vitamin D has been shown to have improvements, mostly in bone health and modestly preventing osteoporosis and fractures. But there may be some effect on what I call sarcopenia, which is loss of lean body mass. So, and there's various reasons that vitamin D might help for this. Again, does it help a lot? Probably not. If you have a diet that's high in vitamin D, for instance, you eat a lot of dairy products, that's probably the best way to get your vitamin D. So supplements are of some benefit, and probably more for certain people who are more frail, already have thin bones, or have other issues like they're on steroids or have had hormone therapy or something like that. So vitamin D, maybe a little bit more evidence, more than C, E, and multivitamins. And then you take the entire realm of antioxidants, supplements, herbal things, and there really is very weak evidence for everything, except for a few things that improve your GI system, ginger and peppermint. Melatonin does seem to have consistent small studies that improve some types of sleep. And then fish oil and some dietary things like turmeric, maybe some very weak evidence. So it's often difficult to give people this for a long time. And then having it in your diet versus a supplement, a capsule or a pill, it probably is different. And whether it really helps sort of overall health benefits is the evidence isn't as strong as you'd like it to be. And a lot of the evidence around dietary supplements, et cetera, have actually been paid for by the companies that make these supplements. So when you ask for independent scientists that can identify clear benefits of these things, you really can't find too many people. It's just not anything that anyone wants to pay for, other than the companies that already make these supplements. And you have to wonder if there is some bias there. Okay. So evidence for all of these things, fairly weak. Buyer beware for sure. Some of these supplements can get very, very expensive, and that's what I talk to people about. I don't know whether anything is helpful or not, but I certainly don't think you should be spending it on something that has really not clear benefits if there's something else you could be spending it on that has better benefits, and we'll go through that as well. And then the last thing I wanted to talk about, and it's an exciting area, is the microbiome. So this is referring to all of the microbes, the bacteria, the fungi, the viruses, and all of their genes that live on or in our bodies. A lot of them live in our guts. We've got, feet and feet of GI, and we often think about the bad bacteria that live inside us, but that's actually millions and millions and billions of good bacteria, or good bacteria that probably do good things for us, but we really don't know what they do as well. It often is affected by your first years of life. So children tend to have the same microbiomes as their parents, but it can change in time because of diet, medications you take, and where you live. They've started to look at different people's bacterial load and different kinds of bacteria that live in and on you, and they've been able to show that there's a correlation between different kinds of bugs and diseases. So certain bugs seem to be just maybe causing more immune dysfunction, perhaps, or causing other toxins that may be causing some of these other diseases like inflammatory bowel disease, cardiovascular disease. This was crazy before, but then when we found that there was a bug that actually caused stomach ulcers, everything sort of turned on its side, and there's been a whole lot more interest in bacteria and what they might be doing to human beings over time. But this is very early research. We really don't know whether any specific diet or pharmaceuticals or anything can really change the microbiome to really have a beneficial effect on you in terms of your diseases or how long you live. So I would say that this is exciting, but we are so early in the research that I would be very skeptical about anyone that said, well, I know how to make your microbiome better and this will solve all your issues. So it's interesting. So what have we seen that maybe does have effects on healthy aging or living longer or living with less disability? It is tough to look at lifestyle because lifestyle is over many, many years. Studies usually, especially Western medical studies, often are only a few months or a couple of years long. So doing a 10, 15, 30-year study is extremely difficult to do. And then in terms of how do you know what people are doing, you can't really watch them for 30 years. So often what you do is ask them, well, what do you remember about what you did? How much did you exercise last week or last month? Keep a diary, and you know how easy it is to sort of do diaries for many, many months in a row. Things are often sort of linked. So if you exercise more, you're likely to smoke less. And so how do you tell the difference between the exercise, the diet, and the smoking? You can try and pull it apart, but it is difficult. And many cultures have sort of things that sort of hang together. So this is why I put a picture up of the Mediterranean diet. And people that live a Mediterranean lifestyle, sort of Greece, southern Italy, seem to live longer, have less heart disease. But what is it? Is it the little bit of red wine that they drink? Is it the seafood that they eat? Is it the fresh vegetables? Or is it in their environment? Are they walking more? Are they exposed to less air pollution? It's really difficult to tell, but we do know that overall, sort of living that Mediterranean lifestyle seems very good for you. Exercise is definitely good, and that's the one thing that I always tell my patients all the time. Exercise, whether you're healthy, less healthy, or even very disabled, any exercise is good. walking and other cardio, running if you can, other types of cardio if you can do it, and then keeping your strength up. Weights, going to the gym, that sort of thing. Those two types of exercise are particularly good for older adults. And we do see that balance training also prevents falls, but it's probably more for people who are at risk of falls. And then in terms of substances, smoking, definitely bad. Pollution, also bad. Air pollution is a huge issue, getting worse with global warming, and something that we have to pay a lot of attention to. Alcohol has mixed sort of effects. Too much alcohol, definitely bad. Possibly red wine, kind of good for you, but only in moderation. And then there's more and more data that coffee on average is actually seems to be good in a number of different ways. And that seems to be not just the caffeine, probably not the caffeine, but the other things that are in coffee itself. And then there's the social theories of healthy aging. So you can't sort of just talk about lifestyle alone. It's very clear that people who are socially more engaged generally do better, live longer, and are healthier. So they have closer family and friend contacts. There's occupational or hobbies that they continue well into later life. Good, solid sleep. And I think we're learning more and more about sleep and its effect on aging, the aging brain particularly, and the importance of maintaining a good sleep hygiene and good sleep habits. Psychological issues, getting rid of negative psychological issues like depression, loneliness, and chronic psychological stress, but also having positive outlook, being generally happier countries, they live longer and live healthier. Meaningful life and the ability, even if bad things happen, the ability to be resilient. So you may have lost your spouse, you may have lost family members, your income may be relatively low, but how resilient are you to be able to deal with that and move on and see the positives in your quality of life? And then overall, people who are higher income, both within a country or between countries, live longer, live healthier, and say that they're happier. They report being happier. So it's all probably tied together. So I just wanted to say a little bit that there's been this book, this Blue Zones. It was written by Dan Buettner. Very interesting theory that there's certain parts of the world, and he specifically targets 5 in this book, including Okinawa, Japan, and Sardinia, Italy, and Loma Linda, California. It's 3 of the places. Small communities where the number of people living to 100 and living to 100 still relatively functional, being still able to look after themselves, very independent, is very high in those areas. And he breaks it down into 9 lessons for living longer. But the bottom line is it's probably multiple factors. Some of it is genetics, but a ton of it is probably lifestyle, social, cultural, et cetera. And the ones that he talks about are relatively small communities and self-enclosed. But I did want to point out that actually this was in the Globe and Mail. This is actually 17 years ago. Richmond, BC holds the secret to a long life. Women in Richmond actually have the longest life expectancy in North America. Overall in Richmond, the life expectancy was 82 years old back in 2005. It's actually recently, they've estimated it to be over 85 years old, which just for Richmond is actually higher than the life expectancy in all of Japan. So Japan being a very long-lived community. So why? You can probably guess. So the Asian immigration effect, they tend to come, and Asian immigrants tend to still eat mostly a very Asian diet, more seafood, more vegetables, less sort of processed foods, and although in Asia, the rate of smoking tends to be relatively high, people in BC tend to, or at least in the Lower Mainland, smoke relatively little. And so at that sort of, you know, immigration pattern of moving from say Taiwan, Hong Kong, China to here, bringing the best things in terms of diet, low levels of obesity, and then also decreasing the low smoking rate probably adds to this. There's a pretty active lifestyle in the Lower Mainland, and that's part of why we all like living here. And obviously, high income, as I said, people who have higher income tend to live longer and live better. And certainly, the Lower Mainland actually has a fairly high income generally. So interesting. We might have our own little blue zone there in a fairly big city like Richmond, BC, and parts of Vancouver. So that's sort of a little tour of aging and what I can say about anti-aging. In terms of the theory of aging, we really don't have one single theory or one single target to be able to live longer or to be able to improve your morbidity. There's a few sort of trendy things that are out there: caloric restriction, supplements, and manipulating your microbes in your body, but not really strong evidence. And I'd be very cautious in people who are older. You might want to, if you're under 60, probably less risk, but as you get older, using these sort of more radical things to try and change your aging becomes more risky. And we do know that healthy living is multifactorial. So diet, exercise and activity, social and occupational and hobbies, psychological and resilience, and then overall culture, society, community so we have to work both on people, families, and communities to be able to really become a healthier city, province, country.